I am Dr. Vijay Nichani, practicing as a private consultant surgeon, general, GI, and laparoscopic in the city of Indore, the state of Madhya Pradesh, India. Welcome, all of you, to my session on the applied anatomy of the foot. Our feet are constantly under stress. No wonder then that the majority of us are going to have some or the other problems with our feet sometime or else in our life. Many factors affect our feet: our activities, our occupation, our health issues, and last but not the least, but most importantly, our footwear, the shoes. The foot is an incredibly complex mechanism. Over the next few minutes, we are going to study the various conditions and the structures related to the surgical procedures of the foot. The most important structures of the foot can be divided into several categories: the bones and joints, the ligaments and tendons, the muscles, the blood vessels, and the nerves. In addition, we shall also study in detail the arches of the foot, the deep fascia of the foot, and the fascial spaces of the foot. The skeleton of the foot is divided into three parts by two imaginary joint lines: the tarso-metatarsal joint line that runs across the foot between the tarsals and the metatarsals, the transverse tarsal joint line that runs between the mid-tarsal bones and the tarsals of the heel and ankle. Thus, we have the hind foot formed by the talus and the calcaneus, the midfoot formed by the five mid-tarsals, the navicular, the cuboid, and the three cuneiforms, and the forefoot formed by the metatarsals and the phalanges. Let us now understand the bones and the joints in more detail. Let us begin with the ankle joint. The human ankle is pretty amazing. Not only does it bear the weight of the entire body, it is also incredibly complex and capable of a wide range of movements. The ankle is sometimes referred to as the mortise and tenon joint. The two long bones of the leg, the larger tibia and the smaller fibula, come together at the ankle joint to form a structure known as the mortise. One of the large bones of the foot, the talus, forms the tenon of the ankle joint by fitting into this mortise. This arrangement forms a very stable ankle joint. The two bones that form the back part of the foot, the hind foot, are the talus and the calcaneus. The calcaneus is also known as the heel bone. The talus is connected to the calcaneus at the subtalar joint. The ankle joint allows the foot to move up and down. The subtalar joint allows the foot to rock from side to side. The hind foot is connected to a set of five tarsal bones that work together. These five tarsal bones together form the midfoot. These are very unique in the way they fit together. There are multiple joints between these tarsal bones. When the foot is twisted in one direction by the muscles of the foot and the leg, these bones lock together and form a very rigid structure. When the foot is twisted in the opposite direction, these bones become unlocked and allow the foot to conform to whatever surface they are in contact with. The tarsals are connected to the five long bones of the foot, called the metatarsals. The joints between the tarsals and the metatarsal bones are fairly rigid. Not much movement occurs at these joints. Finally, there are bones of the toes, the phalanges. The great toe has two phalanges. Each of the other four toes has three phalanges. The metatarsals and the phalanges together form the forefoot. The joints between the phalanges are called the interphalangeal or IP joints. A very limited movement occurs at these joints. The joint between each metatarsal and its first phalanx is called the metatarsophalangeal joint or MTP joint. All the MTP joints together form the ball of the foot, and movements at these joints are very important for a normal walking pattern. The great toe or the hallux is the most important for walking, and also the MTP joint of the hallux is the most common site for problems in the foot. Ligaments are soft tissues that attach bones to bones. Tendons are soft tissues that attach muscles to bones. The thicker the ligament or the tendon is, the stronger the ligament or the tendon is. The large Achilles tendon is the most important for walking, running, and jumping. It attaches the calf muscles to the heel and allows us to rise up on our toes. The posterior tibial tendon supports the arch and allows us to turn the foot inwards. The anterior tibial tendon allows us to raise the foot. The two peroneal tendons run behind the outer bump of the ankle, also known as the lateral malleolus, and help us to turn the foot outwards. A set of tendons flex the toes. Another set of tendons extend the toes. There are two flexor tendons on the plantar aspect of each toe, and there are two extensor tendons on the dorsal aspect of each toe. Many small ligaments hold the bones of the foot together, and many of these form the joint capsules. Most of the movements of the foot are caused by the stronger muscles of the lower leg. Contraction of these muscles is the principal action by which we stand, walk, run, and jump. There are numerous smaller muscles in the foot, which also affect the way that our toes work. Damage to any of these muscles can cause problems in the foot. The muscles on the plantar surface of the foot are arranged in layers. They provide movement to the foot and also provide padding to the sole of the foot. The foot has longitudinal and transverse arches. The longitudinal arch extends between the posterior end of the calcaneum and the heads of the metatarsals. It is one continuous arch, but higher on the medial side than on the lateral side. The medial longitudinal arch is made by the talus, which forms the keystone of the arch. The calcaneus forms the posterior pillar of the arch, while the anterior pillar is made by the navicular, the three cuneiforms, and the medial three metatarsal bones. The lateral longitudinal arch is made by the cuboid, which forms the keystone. The calcaneus again here forms the posterior pillar of this arch, while the anterior pillar is made by the lateral two metatarsals. There are three factors which support the arches of the foot. First, the bony factor, that is, principally the shape of the bones. The wedge-shaped keystone at the apex of any arch is an important structure which, by engineering principles, is a strong support to both the pillars of any arch. Such keystones are commonly seen in the Roman and other historical arches made of stone blocks. Second, the ligamentous factor, that is, the ligaments which connect the bones of the foot together, like staples. And finally, the muscle factor, that is, the pull and the contraction of the muscles. The medial longitudinal arch is principally supported by the ligaments and the muscles, not the bony factors. The ligaments which constitute the supports are the plantar aponeurosis and the plantar calcaneonavicular ligament, also known as the spring ligament. The muscles supporting this arch are the tendons of the flexor haliosus, the flexor digitorum longus, the tibialis posterior, the tibialis anterior, and the intrinsic muscles of the foot. The lateral longitudinal arch is supported by the ligaments and the muscles in addition to the shape of the bones, especially the wedge-shaped cuboid. The plantar aponeurosis and the short and the long plantar ligaments constitute the main ligamentous supports. The muscle supports are offered by the tendons of the peroneus longus, which crosses the sole from the lateral to the medial, the digitorum longus to the lateral two toes, and the intrinsic muscles of the little toe. The transverse arches are a series of smaller arches that run across the foot from side to side and extend from the head of the talus to the heads of the metatarsals. The more prominent of these arches is in the midfoot at the level of the tarso-metatarsal joints. This is made by the three cuneiforms, the cuboid, and the bases of the metatarsals. The middle cuneiform is the keystone of this arch. The shape and arrangement of the bones, especially the wedge-shaped mid-tarsals, contributes stability to these arches. These bones are held together by the tarso-metatarsal ligaments. The peroneus longus is the most important support as it crosses the sole from the lateral to the medial and pulls the medial end of the arch towards the lateral side. The tonic contraction of the adductor haliosus muscle also maintains this arch. The deep fascia of the sole is thickened at the center to form the plantar aponeurosis. It is triangular in shape. Its apex is attached to the calcaneus. Its base divides into five slips that run to the connective tissue around the fibrous flexor sheaths of the toes. These slips are connected by ligaments, thus limiting the movements of the toes. The plantar aponeurosis gives a firm attachment to the overlying skin and stabilizes the foot on walking. It serves as a surface for the attachment of the intrinsic muscles of the foot. It protects the underlying soft tissues like vessels, nerves, and tendons. It assists in maintaining the arches of the foot. Since it is made of collagen and thus not stretchable, when the toes dorsiflex, it winds around the heads of the metatarsals and becomes taut, therefore brings the calcaneus closer to the metatarsal heads and raises the arch. Finally, it acts as a lever and a shock absorber. The plantar aponeurosis sends two septa towards the inferior aspects of the first and the fifth metatarsals, the medial intermuscular septum and the lateral intermuscular septum. Then there is an interosseous septum which runs transversely beneath the metatarsals. These septa divide the foot into four compartments. The central compartment, which contains the muscles which are arranged in layers. The interosseous compartment, which is again composed of four compartments, each containing the plantar and the dorsal interosseous muscles. The lateral compartment, containing the intrinsic muscles of the little toe, and the medial compartment, which contains the intrinsic muscles of the big toe. Here, in these diagrams, we can see the plantar fascial spaces, which can be described as follows. The first space lies superficial to the calcaneus and the plantar aponeurosis. The second space lies between the plantar aponeurosis and the flexor digitorum brevis muscle. The third space lies between the flexor digitorum brevis and the quadratus plantae muscles. The fourth space lies between the quadratus plantae muscle and the tarsal bones. And the fifth space lies deep to the adductor hallucis muscle. The first space is a closed space and does not communicate with the other spaces. So any infection here shall remain confined to this space only. All the other spaces, from the second to the fifth, communicate with each other, and infection in one space can extend into any space above or below. The third space deserves special attention because it contains the neurovascular bundle, and any infection here can travel along this bundle down to the toes or up into the leg. The main blood supply of the foot, the posterior tibial artery, travels underneath the medial malleolus to the sole of the foot where it forms an arch just behind the ball of the foot. Another artery, the dorsalis pedis, runs down the dorsum of the foot. Here we see the branches of the anterior tibial artery. It gives the lateral and the medial malleolar arteries and then continues in front of the ankle as the dorsalis pedis artery. The dorsalis pedis artery now gives the lateral and the medial tarsal arteries, followed by the arcuate artery, which runs laterally and gives the second, third, and the fourth dorsal metatarsal arteries. The dorsalis pedis artery then gives off the first dorsal metatarsal artery and finally dips down into the first intermetatarsal space and joins the lateral plantar artery to complete the deep plantar arch. The posterior tibial artery passes behind the medial malleolus deep to the flexor retinaculum. It gives the posterior medial malleolar artery and then the medial calcaneal artery. It then enters the sole of the foot and gives the medial plantar artery and the lateral plantar artery, which will curve medially to form the deep plantar arch. The peroneal artery lies on the lateral side of the ankle. It gives the lateral calcaneal artery and the anterior perforating artery that will communicate with the branches of the anterior tibial artery in front of the ankle. An angiosome is defined as an anatomic unit of tissue composed of the skin, subcutaneous tissue, fascia, muscles, and bones, and supplied by a source artery. The adjacent angiosomes are bordered by choke vessels. These are vessels of a diameter smaller than the source artery, have the capacity to dilate and increase the blood flow if there is an obstruction in any one of its source arteries to any one of the corresponding angiosome. There are 6 angiosomes in the foot and the ankle. They are supplied by the 3 main arteries: the posterior tibial artery to the sole of the foot, the anterior tibial artery to the dorsum of the foot, and the peroneal artery to the lateral supramalleolar area and the heel. The dorsum of the foot is supplied by the dorsalis pedis artery. The heel is supplied by the branches of the posterior tibial artery and the peroneal artery. The medial third of the sole of the foot is supplied by the medial plantar artery. The lateral two-thirds of the sole and the lateral 4 toes are supplied by the branches of the lateral plantar artery. And finally, The big toe is supplied by the branches from the dorsalis pedis artery, the medial plantar artery, and the lateral plantar artery. The main nerve of the foot, the posterior tibial nerve, runs down the side of the medial malleolus into the sole of the foot. It supplies sensation to the toes and the sole of the foot and also controls the muscles of the foot. Several nerves also run down the dorsum and the outside of the foot, supplying sensation primarily to the dorsum and the lateral aspects of the foot. So, in conclusion, we see that the anatomy of the foot is very complex. When everything works together, the foot functions correctly and allows us to walk with ease. Thus, it is easy to see why a stable, pain free foot is so important in our daily lives.